just to facilitate thalassemia victims and to encourage them to live their life, because it's thalassemia major is a lifelong thing. Okay. As we go on, I'll tell you, because they need continuous blood transfusion. You must have heard about it. Thalassemia major. Thalassemia minor, you don't need any treatment and they can live. All right. This is the World Thalassemia Day. All right. The hemoglobin structure, you know hemoglobin structure, having 4 hemes, 4 iron pockets, and we have already done it. So we are not going into the details. The only thing is that the normal RBC, the biconcave shape, it's all distorted, it's all deformed in case of thalassemia, right? The malformed red blood cell. Now the word thalassemia, it was derived from the Greek word thalos means sea and hemia means blood. It is with reference to the anemia of the sea. The name was given because the people living near Mediterranean Sea, there was a high incidence of this disease. Okay. It's a quantitative abnormality of globin chain synthesis, a blood disorder or an inherited disorder in which the body makes an inadequate amount of globin or does not make globin at all. You see, you did in hemoglobinopathies. It's broadly classified into 2 main things. One is your qualitative and the other is quantitative. Okay. So when you talked of sickle cell anemia, hemoglobin S or hemoglobin D or whatever other hemoglobins, that is coming in hemoglobinopathies, but that is a mutation. Okay. One of the amino acid is wrongly placed over there or misplaced in that sequence. So that is point mutation or a deletion of an amino acid. But here in thalassemia, there is quantitative deletion of the gene. Okay. As we go on, you'll understand. So this was just a brief review of it. Okay. Now the location of thalassemia. Alpha thalassemia is most often in people from Southeast Asia, Middle East, China, and Africa, India, and Burma. And usually people from African descendants, they do have alpha thalassemia. Then beta thalassemia occurs most often in people of Mediterranean origin, in Chinese, other Asians, African Americans, West and Southeast Asia. That was the location. Okay. Now, this thalassemia occurs when there is a defect in the gene that helps control production of one of these protein chains, either your alpha protein chain or your beta protein chain. The globin has, remember, the globin is made up of 2 alpha, 2 beta in hemoglobin A. Okay, we are talking of A. The disorder results in large numbers of red blood cells being destroyed, which leads to anemia. Now, thalassemia is an autosomal recessive disease. Okay, it's not a dominant. As we go on, I'll explain you the difference, where the difference comes. Okay, right now just understand it's being a recessive, and the genes for this is on chromosome 16 and 11. Okay, just keep that in mind, 16 and 11. As we go on, I'll go on explaining to you a little bit more about this. The 2 alpha globin chains, hemoglobin A1, that is alpha 1 gene, and hemoglobin A2. They are located close together in a region of chromosome 16 known as alpha globin locus. Okay, on the chromosome, the alpha 16 is the alpha globin gene. Okay, the human beta globin locus is composed of 5 genes located on a short region of chromosome 11. On chromosome 11, there is a location there where your beta globin chain is there. But beta globin chain has 5 genes. You see, we have epsilon, we have delta, and so on. We don't go into the depth of it because that will be more confusing. Okay, so this point is enough that the beta globin gene is on chromosome 11 and alpha globin gene is on chromosome 16. Okay, because if you go into the depth, it will create more confusion. Now, it occurs due to, the main thing is that it occurs due to defect in the genes of either of the parents. Okay, either of the parents. It can be mother or it can be father. If only one parent suffers from thalassemia, Thalassemia minor will be manifested in the fetus and the child will act as a carrier for thalassemia. Okay, if only one parent is suffering from thalassemia, it's thalassemia minor. And I think this thalassemia minor is very common in our country, in Pakistan. Because in my family, we have my own auntie suffering from minor and all her siblings, 3 siblings are suffering from thalassemia minor. Now, that is what we usually, it's my own family history, so I'm telling you about it. Now, if both the parents suffer from thalassemia, thalassemia major is manifested and the child suffers from severe anemia. See the difference? If the child is inherited both the genes from both the parents, mother and the father, it's thalassemia major. But if it's inherited from one, it's thalassemia minor. Okay. Now, the next slide in this shows that it's a hemolytic disorder and there is either alpha globin or beta globin chain decreased or reduced synthesis or total absent. Okay, in thalassemia, I hope you can see this screen. Thalassemia, we have alpha thalassemia and beta thalassemia. Okay, so either there will be reduced production or no production of at all. Now, this slide shows the inheritance, whether the father is the carrier, the mother is normal. But then from the father, if the child inherits, will be a carrier because the mother was normal. Both of them have got, if both of them are thalassemic patients, then the fetus will have thalassemia major. All right, now I want you to see this slide. This is Greek letter. This is used to designate Globin chain. Okay, see, beta thalassemia is common in blacks, Greek and Italians. Okay. Beta chains are encoded by a single beta globin gene located on chromosome. Means reduced production. Beta plus sign here. Can you see this sign here? Beta plus. That is reduced production of globin chain by gene. Okay. And beta not here. This sign of beta 0 or beta not. This is no production of globin chain. Okay. Plus sign means reduced production and this sign not of here means no production. I'm going to use this 2 points further on in the further slide. So remember, B plus means diminished, reduced production, and B not means no production of the globin chain or of the alpha chain. All right. Now again, globin abnormality, qualitative and quantitative. This is the slide which in a table form, in a tabulated form, I've tried to compare both qualitative and quantitative. And I want you to remember these points because see, these points are just not for today. These are for your future also. Now see, qualitative, it occurs as a result of genetic mutation involving globin chain. This is mutation. It can be point mutation also, where only one amino acid can be deleted, just like valine and glutamic acid in hemoglobin S. All right, in sickle cell. Okay. Then the point here, this quantitative. Okay, quantitative means thalassemia. It occurs as a result of genetic defect that causes reduced synthesis of globin chain. In here, there is amino acid deletion or substitution, right? But this is qualitative, right? Now in quantitative, the globin chains are structurally normal. There is no problem with the chains. Qualitative, there is point mutation from anywhere, or there can be a deletion of an amino acid, a substitution of amino acid, and that changes the whole shape of RBC. But in case of thalassemia, in thalassemia, the RBCs, the globin chains are structurally normal, but there is reduced synthesis or no synthesis of either alpha or either beta chain. Okay, these mutations cause structural variation of the globin chain. Okay, now collectively this is known as thalassemia. Coming to qualitative, we have example of hemoglobin S, hemoglobin C, hemoglobin M, and so on. While in thalassemia, we have alpha or beta thalassemia. What the point? All right. Now, types of hemoglobin. Hemoglobin A is alpha 2, beta 2. 97% of adult hemoglobin, we have alpha 2 and beta 2 chains. Hemoglobin A2, we have alpha 2 and delta 2. That is 2.5% adult hemoglobin. We have hemoglobin A2. Hemoglobin F, the fetal hemoglobin, having alpha 2 and gamma 2. That is a normal fetal hemoglobin. Now, then we come to hemoglobin H and hemoglobin bonds. See, hemoglobin H means all the beta chains are there. Alpha named. Okay, no gamma, no delta, but we have beta 4. All the 4 globin chains are of beta type. So beta 4 thalassemia is of hemoglobin H. And then we have hemoglobin bonds, that is gamma. All the chains are gamma 4 of thalassemia. Remember, this is also known as hydrophytalis. Survival of the fetus is not possible. Okay, coming to this slide. Now see, chromosome 16, chromosome 11. Okay, I hope you all remember this point. Okay, now see, in chromosome 16, we have normally alpha 2 and epsilon. Okay, and then delta. Now this, for the grower, HB grower hemoglobin, it is coming from here, the epsilon and then the delta one. And then here we have alpha 2 and gamma 2 for hemoglobin F fetus. Then here we have the 2 alphas. Okay, now these 2 alphas coming for hemoglobin A and hemoglobin A2, while beta 2, beta coming for HbA2 and this delta coming from HbA2. This is epsilon, I don't know, I think this is eta. This is eta, hemoglobin grower 1 embryo. This is it for the embryo. All right. Now, again, there are 2 main types of thalassemia, okay? Alpha thalassemia and beta thalassemia. Now, alpha occurs when the gene or genes related to the alpha globin protein or alpha globin chain is missing or changed. Beta thalassemia, when the gene or genes related to the beta globin protein is either missing or it's reduced synthesis. Alpha and beta thalassemia both include the 2 forms. What are those? Thalassemia major and thalassemia minor. It's the same for alpha thalassemia. It has got major and minor. Beta thalassemia has got major and minor. People with minor form of alpha and beta thalassemia have small RBCs but no symptoms. Okay, their RBCs are small but there is no symptom. They can live a normal, healthy life and they can even have siblings. Now, thalassemia major. Now, if a child inherits the genetic defect from both the parents. Thalassemia major, if a child inherits the genetic defect from both the parents. The child suffers from acute case of thalassemia. While thalassemia minor occurs if the child receives the defective gene from only one parent. As I told you in the beginning, major occurs if the child inherits both the genes from the parents, both the parents are the affected or the carriers, and then they give their genes to the child. Then it is major. Otherwise, it is minor if it is coming from a single parent, mother or father. The child will act as a carrier for thalassemia or thalassemia minor and usually has no symptoms. Okay, and you know, when it is discovered thalassemia minor, if there is a time for blood transfusion or if the person wants to donate blood to somebody, then it is discovered that, oh, he has got thalassemia minor. Understand? Otherwise, the person can live a very normal, healthy life. Right. Now, symptoms, okay? Now, the symptoms for the alpha thalassemia, it's very, very severe and it causes major stillbirth, okay? With alpha thalassemia major, stillbirths have been caused. For children born with beta thalassemia major, it's also known as Cooley anemia, okay? There's an apostrophe S here, Cooley's anemia. They are normal at birth, but develop severe anemia during the first year of life and survival is not possible. With beta thalassemia major, known as Cooley's anemia, the children at the time of birth, they are normal, but they develop severe anemia during the first year of life and they require blood transfusion. Then survival is possible. Okay. This is for the normal. You all know, I've seen these slides for the normal and for the anemic patients. And I'm sure you have been doing it for the blood since last week, 2 weeks or 3 weeks. So you all know about the physiological things. All right. Now we're talking of signs and symptoms present in a patient with thalassemia major. Okay. There is fatigue, weakness. Of course, the person is anemic, so fatigue and weakness will be there. Pale or yellowish skin, so it can be mistaken for being a jaundice patient, but this is because of anemia. Facial bone deformities, slow growth, abdominal swelling, dark urine, and some babies show signs and symptoms of thalassemia at birth because when they are born, their face is swollen and the nose is all widened, the bridge is widened, and the frontals are also, like a swelling. And some babies develop them during the first 2 years of life. Okay, the symptoms will develop during the first 2 years of life. See this child? See here? Look at her. Look at her nose bridge. Look at this child with the frontals. See? You see this picture? Okay, and this is a Middle Eastern boy. See his prominent maxilla, widening of the bridge of the nose. Even here, see the nose, widening the bridge of the nose, and marked bossing of the frontal and parietal bones. Okay, all right. Now, this was the sign of symptoms, but how do we diagnose thalassemia? Diagnosis of thalassemia is like on the basis of electrophoresis of hemoglobin. See, on the basis of electrophoresis, when the hemoglobin is put on an electric field, the migration of the hemoglobin, like A2, hemoglobin alpha, hemoglobin having deficiency of alpha and beta chains. So we can, on the basis of that, it is there. I'm not going into the depth of this, okay? But just electrophoresis of hemoglobin itself will tell us. Then RBC count, of course. Then MCV, mean corpuscular volume, mean corpuscular hemoglobin volume, RBC morphology, and reticulocyte count. All these things, you see, will tell us whether it is thalassemia or not. Okay. Now this goes for both alpha and beta. The diagnostic reason, the RBC count, MCH, all these tests, we will be doing it, or it's already being done in our labs. But this is, I'm not separating alpha and beta, okay? Because this goes for both alpha as well as beta. All right. Then we come to alpha. Alpha thalassemia major. Now see this sign here, I told you we'll go on with the signs. Beta, not. Now these patients have severe anemia and need blood transfusion. For thalassemia minor having beta, these patients have severe anemia and need blood transfusion. The iron overload causes hemocytosis and causes death by age 15 to 25 years. You know about hemocytosis, there is accumulation of too much of iron in the tissues. Okay, that's hemocytosis. And then there is death by 15 to 25 years. Okay, there's one point here. See, the patient is of thalassemia major and blood transfusion is being repeatedly done. Okay, every 3 months or 4 months or whatever is the time given by the physician, the patient, the child has to be transfused. Now, overall, going on with this blood transfusion, iron overload occurs because that load of iron cannot be excreted out of the body. Now, for such people, there is a therapy known as chelation therapy or chelation therapy. It is CHELA. TING, chelation therapy. Okay, even I mentioned that therapy after a few slides. Okay, when we come to the treatment part. Now this is required because your iron would be collected in the tissues or deposited. So to remove them, that therapy is required. Heavy metals are used to remove the iron overload. Okay, all right. Now back to where we were. Okay, thalassemia minor. We did of major, आगे भी है, okay? We'll go on discussing it again and again. A thalassemia minor क्या है? It's a heterozygote. Heterozygote for beta thalassemia, for thalassemia minor, and they do not need treatment. Okay? ये thalassemia major homozygous हो जाता है, having from both the parents. Thalassemia minor is from either of the parents, and it does not require treatment. Okay? इसके symptoms भी वैसे नहीं. Acha, we stop here, and I want you to understand this. You have gone through this, I suppose so, but anyway, we'll talk about it here in just two lines, okay? It's hereditary persistence of fetal hemoglobin. Hereditary persistence of fetal hemoglobin, known as HPFH, is the major hemoglobin in the fetus, has alpha 2 and gamma 2 chains. But after birth, hemoglobin F, the fetal hemoglobin, is replaced with normal hemoglobin A2, composed of A2 and delta 2 chains. Right? But in HPFN, hereditary persistence fetal hemoglobin, there is excess production of gamma chain. There is increased formation of hemoglobin F in these adults with no symptoms. Okay, this hemoglobin F, okay, it goes on in the adult life, having alpha 2 gamma 2 chains, that is fetal hemoglobin, and it will be persistent in adult life also, but it does not cause any problem. Okay? There are no symptoms, nothing, no problem. The patient can live around it. There is no problem. Okay. All right. We talked of beta thalassemia. Now we talk of a bit about alpha thalassemia. Okay. The alpha chains are encoded by two alpha globin chains which lie in the tandem on chromosome 11. ठीक है? Chromosome 16 पे था बीटा, remember? आगे बोला था ना कि chromosome 16 पर बीटा के localized है और chromosome 11 पर it is for alpha. There's a small region, okay, on the chromosome 11 which will guide that this will be for alpha chain. ठीक है? Okay. Each chromosome carries two genes. Okay? Our chromosome के two genes. Therefore, the total complement of the gene in an individual is 4. Okay, ना? 4 होता है ना, 2 alpha, 2 beta. Now, due to the deletion of the two genes, HB1 and HB2 genes, अगर B1 मतलब beta 1 and beta 2 genes की deletion है, so that would result, okay, in beta, otherwise alpha. All right. अब देखो, alpha thalassemia. One allele inherited from the father and another allele from the mother makes up for the 4 alleles required for the synthesis of alpha globin chain. 2 alpha, ठीक है, अब 2 alpha, लेकिन उसके alleles 4 हो जाते हैं. Now, if it is one is inherited from the father and the other from the mother, it will make up 4 alleles that is required for the normal synthesis of the 4 of the alpha globin chain. Now, if one alpha globin chain is deficient, there is minimal effect on patient's life. अगर एक alpha globin chain deficient है, so that is thalassemia minor. Okay, thalassemia minor is because the inheritance is from one parent, right? And there is minimal effect on patient's life. Genetic testing भी करते हैं. Yes, we go for diagnosis के लिए हम सिर्फ blood test नहीं, अब तो genetic testing and genetic screening भी होती है. Genetic testing providing a genetic test to someone who's thought to be at increased risk, like affected relative or member of at-risk group. All right. Again, a little bit of personal problem, a personal thing. I know someone. The girl is from Africa, from African origin, and of course she's getting married. So the susral wale कहते हैं उसके, they went through the genetic test that she should not be a carrier of thalassemia. So अभी भी अब लोग ये कर रहे हैं. Okay, now people are going for it. So ये genetic screening हुई है, it offers a test to all members of a population to identify those at increased risk. That is for genetic testing. Okay. मतलब दिस इज नाउ अकरिंग, हमारी अपनी सोसाइटी में अब ये हो रहा है, पहले नहीं होता था लेकिन अब हो रहा है. ये तो बिल्कुल रीसेंट केस है जो मैंने आप लोगों के साथ शेयर किया है. ओके, अच्छा, अब जीनोटाइप देखो, हीमोग्लोबिन ए, हीमोग्लोबिन A2 एंड हीमोग्लोबिन F का, HbA, HbA2 एंड HbF. देखो, इट्स नॉर्मल 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 नॉर्मल, सब में नॉर्मल है. बट इफ इट्स अ साइलेंट कैरियर देन आल्सो इट्स ऑल नॉर्मल. ये सारे हीमोग्लोबिन्स नॉर्मल होंगे if the person is silent carrier. Okay, whether it's alpha or beta, silent है. Okay, beta thalassemia minor है. अगर minor है तो HbA थोड़ा डिक्रीज होगा, नॉट वेरी मच नॉर्मल बट डिक्रीज a little, then normal to increase, HbA2 थोड़ा ज्यादा बढ़ सकता है, HbF भी normal to increase. बीटा थैलेसीमिया इंटरमीडिएट मीन्स थोड़े से चेंज मौजूद है, थोड़ा बीटा ग्लोबिन एब्सेंट है, तो वो डिक्रीज है. नॉर्मल टू इंक्रीज, हीमोग्लोबिन A2 and hemoglobin F is increased. All right, then we have beta thalassemia major. Then there is a decreased formation of hemoglobin A. Hemoglobin A2 usually increased, and for hemoglobin F it is increased. This is for beta thalassemia major. A तो डिक्रीज ही है, A2 थोड़ा बढ़ जाएगा और F ज्यादा ही रहेगा. Alright, okay. Then अल्फा थैलेसीमिया पर आ गया, तब दोबारा से हम अल्फा पे आ गए. ओके, वी आर गोइंग ऑन शिफ्टिंग फ्रॉम अल्फा टू बीटा, बीटा टू अल्फा, अगेन बैक टू अल्फा. The two genes inherited from each parent. It's a more heterogeneous picture, usually caused by gene deletion. देखो gene deletion है, minus the gene. Clinical picture varies with the number of deletion. Either both the genes are absent or one gene is absent. It can result in one gene deletion, that's a silent carrier. अगर एक जीन का डेफिशिएंसी है, देखो यहाँ पर एक है, 3 है, instead of 4 there is only 3, so it's a silent carrier. But if 2 alpha both genes are missing, 2 gene deletion, तो फिर that would be a case of major thalassemia. Okay, all right. Genotype पे देख लो. The genotype is your genetic picture of it. This is 2 alpha. Number of genes both चारों functional है. Phenotype is normal. ठीक है, the person will be normal. जैसे फादर का मदर का था, वो उसने वही इनहेरिटेंस हुआ है, उसके हेयर का कलर, आइज का कलर सब नॉर्मल है. नाउ देन अगेन जीनोटाइप में 2 अल्फा है, लेकिन यहाँ से एक अल्फा माइनस जीन है. ऑलराइट, कमिंग फ्रॉम आइदर पेरेंट. देखो एक अल्फा है, एक अल्फा की जीन मिसिंग है, तो क्या हुआ, फंक्शनल जीन 3 है, बट अगेन इज अ साइलेंट कैरियर, नॉर्मल है. देन माइनस अल्फा, मे बी 1 अल्फा फ्रॉम द मदर, 1 अल्फा फ्रॉम द फादर, दोनों मिसिंग है, तो फिर ये he is having only 2 genes. 4 functional genes के बजाय 2 functional genes हैं, and MCV, MCH, रेटिकुलोसाइट सब कम हो जाएगा, ब्लड पिक्चर पूरा डिक्रीज आ जाएगा. मॉर्फोलॉजी पे चले जाओ, वो भी डिसरप्टेड. देन यू कम टू अल्फा, जो मे बी कमिंग फ्रॉम द मदर साइड, दोनों डिफेक्टिव है, दोनों जीन्स की डिलीशन हो गई है, एक पेरेंट से दोनों अल्फा आ रहे हैं, तो बी ए हैविंग 2 नॉन जीन फंक्शनल and reduced MCV and MCH. All right. Then we have 3 gene deletion. ठीक है, सिर्फ एक ही जीन बचता है. 3 जीन्स अल्फा के तो नहीं है, सिर्फ एक अल्फा का जीन है, और that is hemoglobin H disease. All right. ये इसका जो हमने कहा था कि the child is born with hemoglobin H, कोई सर्वाइवल वाली प्रॉब्लम, स्टिल बर्थ वाला. Then we have from both the parents, all the 4 genes functional are missing. चारों genes defective है of alpha hemoglobin paths, उसको कहते हैं, या hydrophetalis भी कहते हैं. Okay, usually generally हम इसको hydrophetalis बोलते हैं. See on fetal red cell, वही चीज मैं बता रही हूँ दोबारा से, मैं अल्फा और गामा की बात कर रही हूँ. ठीक है, fetal hemoglobin, fetal red cell, fetus में क्या होता है, अल्फा एंड गामा genes. तो 2 अल्फा 2 गामा है, अब लेकिन दोनों अल्फा मिसिंग है, दोनों गामा प्रेजेंट है. देन दोनों गामा दोनों अल्फा, वी हैव 2 गामा एंड 2 अल्फा, बट 2 गामा एंड 2 अल्फा मिसिंग हियर. देन वी आर जस्ट कंपेयरिंग इट विद द पिक्चर. देन नॉर्मल MCH इज 35 पिकोग्राम, ठीक है, लेकिन यहाँ पर 20 पिकोग्राम है. ओके, एंड देन सेम 20 पिकोग्राम बिकॉज इट इज डेफिशिएंट इन हैविंग 2 गामा चेन. Then hemoglobin A 8% है, hemoglobin gamma के 4 है, and that is 3%. And then you can see this picture, normal, and then with the alpha thalassemia trait है. Okay, okay. Here there is alpha thalassemia का trait है, जिसमें hemoglobin gamma के 4 है, it's 3%, and hemoglobin A is only 8%. Fetal hemoglobin is 89%, but there is a deletion of 2 alpha genes. Then here there is gamma because it is a major thalassemia alpha and hemoglobin bars भी है, hydrophytalis भी है. So you can see here 2 alpha chains up, 2 gamma chains. All 4 gamma में से 2 इधर भी missing है, 2 इधर भी missing है. Okay. Thalassemia major minor. This is just to show the normal picture. Actually मैं दिखाना तुमको चाह रही थी was Ames body. आगे है I'll show it to you. Now see alpha thalassemia, 2 alpha globin chain is deficient. Alpha thalassemia का trait है, ये ना 2 globin chains. But all 3 alpha globin chains are deficient is hemoglobin H. 3 deficient थी ना, okay. Now if we have all 4 alpha globin chains, this condition is incompatible with life as tissue oxygenation is deficient. All right, all 4 globin chains. ऐसा वो तो major होगा. And such patients have both hemoglobin H and hemoglobin bars, all 4 gamma chains. Baby dies in utero. Uterus में ही death हो जाती है, which is we call it hydrophytalis. And or if the baby is born, he dies just after birth and will have hemoglobin bars. All 4 globin chains are there. Okay, missing. Okay. Now anemia is caused due to lack of hemoglobin chains and the effects of excess unpaired non-alpha chains. अब देखो क्या होता है, बीटा गामा एंड डेल्टा चेन्स आते हैं. ये पॉइंट बस ये समझ लो इन शॉर्ट. देखो बीटा एंड गामा चेन्स अब टू मच वाटर सॉल्यूबल. ओके, बीटा चेन्स एंड गामा चेन्स अगर वो थोड़ी भी फ्री हैं, दे आर नॉट बाइंडेड इनसाइड द हीमोग्लोबिन मॉलिक्यूल, फ्री हैं तो दे आर मोर वाटर सॉल्यूबल, मोर प्लाज्मा सॉल्यूबल, एंड देन दे फॉर्म अ स्टेबल स्टेट homotetramers बना लेते हैं. ठीक है, they join together because they are more soluble. So all these free beta and free gamma या free delta chains, they combine together and they form a precipitate like thing which causes hemolysis in the RBC and ineffective erythropoiesis also occur. Okay, but it is less severe in alpha thalassemia as compared to beta thalassemia. एक बात याद रखो कि बीटा गामा डेल्टा सारी चेन्स दे आर मोर वाटर सॉल्यूबल और दे जॉइन टुगेदर फॉर्मिंग अ पीपीटी और एन एग्रीगेट. पीपीटी तो नहीं बोलेंगे, कॉन्जुगेटेड एग्रीगेट्स बोल सकते हैं. दे फॉर्म एन एग्रीगेट लाइक थिंग, दे डिपॉजिट इनसाइड, दे कॉज हेमोलिसिस ऑफ आरबीसी. ठीक है, बट अल्फा थैलेसीमिया इज नॉट दैट मच प्लाज्मा सॉल्यूबल. ठीक है, तो इस तरह से वो इस तरह से एग्रीगेट नहीं बना. ओके, अल्फा थैलेसीमिया का तो है तो इट डज अल्फा आई मीन थैलेसीमिया नहीं, लेकिन अल्फा चेन्स जो है दे आर रिलेटिवली स्टेबल एंड नॉट सो मच वाटर सॉल्यूबल. Now RBCs have Haynes bodies and rupture easily causing hemolysis and jaundice. ठीक है, ये है Haynes bodies. ठीक है, इस तरह की होती है and this is because of those aggregates, the beta and the gamma chains की जो भी मैंने बात की. ओके, अच्छा, 2 लाइन हाइड्रोफिटालिस की तरह देख लेते हैं जल्दी से. This condition occurs in the prenatal stage of fetus. It occurs when the 4 genes responsible for alpha globin chains are absent. Okay? Stillborn babies or death of babies occur just after parturition. अगर baby stillborn नहीं है तो death can occur soon after he is delivered, after the child is delivered. All right, now we talk a bit about beta thalassemia. ठीक है, देखो deficient production of beta globin chain, inefficient erythropoiesis हो रही है, fragile RBCs है, increased unconjugated bilirubin and microcytic anemia. देखो unconjugated bilirubin increase होता है इसलिए भी वो pale yellow color jaundice का effect दिखता है. All right, because your unconjugated bilirubin is increased. Right, then we have microcytic anemia. अब हम बात कर रहे हैं beta thalassemia major पर. All right, beta thalassemia is also associated with hemoglobin E. ठीक है ना, जिसमें deletion of the amino acid. It's very common in Southeast Asia, beta thalassemia major and minor. Okay. अब देखो beta genes from father and beta genes from the mother. With a mutation of one of the 2 beta genes, a carrier is formed. अगर एक father की तरफ से missing है या mother की तरफ से, that the child is a carrier is minor, but enough of hemoglobin. Hemoglobin enough होता है. Now without a mutation there is enough hemoglobin. ये thalassemia का carrier नहीं है. देखो चारों alpha, beta सब मौजूद, but with one mutation less hemoglobin. ठीक है, अगर mutation है कहीं तो एक hemoglobin मतलब ये पिक्चर शो कर रहा है बीटा थैलेसेमिया कैरियर विदाउट इलनेस बट लेस हीमोग्लोबिन, स्लाइट एनीमिया है, ओके, विथ 2 म्यूटेशंस, नो बीटा ग्लोबिन मेजर है, बीटा थैलेसेमिया मेजर पेशेंट विथ सीवियर एनीमिया, इसमें 2 ग्लोबिन चेन्स मिसिंग, ऑलराइट, ओके, अगर एक है तो माइनर है। Now 3 types of beta thalassemias are there. Beta thalassemia trait है, one affected allele of chromosome 11. Beta thalassemia intermedia, 1 or 2 affected alleles but only mild symptoms experience. देखो alleles अपने पास 4 होते हैं ना, 2 alleles for 1 and 2 alpha for the other gene. Beta thalassemia major, both alleles are affected and require blood transfusion and drug treatment to survive. Now बीटा थैलेसेमिया मेजर की बात करते हैं, अगर ये एब्सेंट है तो देखो ये साइन बताई थी ना, होमोजाइगस स्टेट, बीटा बीटा 2 का मतलब रिड्यूस्ड है, अगर ये एक रिड्यूस्ड है और एक टोटली एब्सेंट है, ओके, और एक दोनों टोटली एब्सेंट है, मींस कमिंग फ्रॉम बोथ द पेरेंट्स, दिस इज कमिंग फ्रॉम वन पेरेंट एंड द अदर वुड बी अ कैरियर जो उसने अपने बच्चे को दिया, राइट, एंड ऑटोसोमल रिसेसिव डिसऑर्डर एसोसिएटेड विद म्यूटेशन इन बीटा जीन्स, hemoglobin के बीटा जीन्स, severe anemia requires blood transfusion, increased HbA2, HbA2 कितना होता है 4 to 6%, hepatosplenomegaly भी हो जाता है, okay, enlargement of both, and then electrophoresis shows increased HbF, HbA2 and absence of hemoglobin A. hemoglobin A तो होता नहीं है, ठीक है, तो क्या होता है Hb fetal बढ़ जाता है and HbA2 बढ़ा हुआ होता है, and it is also known as Cooley's anemia or Mediterranean anemia. Beta thalassemia major जो homozygous state है coming from both the parents, it's also given the name of Cooley's anemia or Mediterranean anemia. जो हमने पहले शुरू में कहा था ना, देखो वही पिक्चर रिपीट की है मैंने just to revive our memory. Okay, a beta thalassemia major, देखो साइंस वही है, ठीक है, now it major, it manifests at 6 to 9 months after birth. Or hemoglobin level just 3 to 6 grams per deciliter, just 3 to 6 grams, and it can be seen just 6 to 9 months. Clinical feature, now if untreated, it becomes severely anemic and dies within 1 to 2 years. Death would die if you are not treating the patient. But the survived ones have enlarged cheekbones, cardiac diseases, hepatosplenomegaly, and secondary hemochromatosis. Now, beta thalassemia intermediate means having one allele, one gene. It is also severe but does not require blood transfusion. But minor is with not having or completely deleted or one normal, or it can be having reduced and one coming from the other parent would be normal. This is coming from one parent, the other parent is no. Coming with thalassemia minor, एक parent को होगा, उससे आ गया, उससे inherit हुआ है, और एक parent normal था. What are the clinical features? Mild asymptomatic anemia, कभी हो सकता है, and your blood picture shows RBC abnormalities, including hypochromia and microcytosis. Mild erythroid hyperplasia, okay, but that is going on a high altitude. Hemoglobin electrophoresis reveals increase in HbA2. Different types of thalassemia and their clinical symptoms. Types of thalassemia में देखो, I hope you can see this picture on my screen. It's a long one. Okay, but this is the second last slide, so we can go through it. Time है? Can I go on? All right. Beta thalassemia gene, it is homozygous. Okay, homozygous state coming from both the parents. क्या हुआ? Anemia severe and high level of hemoglobin F. Increased level of hemoglobin A2 in case of thalassemia gene having heterozygous state. All right. Then beta thalassemia with no hemoglobin A production, but in having a homozygous state, severe anemia, hemoglobin consists of F and A2 only. देखो hemoglobin A नहीं, only F and A2. Same as above. Increased level of hemoglobin A2 if it is heterozygous state. Then in beta thalassemia, beta and delta. Severe anemia with hemoglobin F only F will be present. And in heterozygous state, normal level of hemoglobin A2. Then again, we have We have hemoglobin, leopard, thalassemia. It's severe anemia with hemoglobin, leopard, and F. Hemoglobin leopard present and normal level of A2 hemoglobin. It's just the name given, okay? The alpha thalassemia, major की बात कर रहे हैं. It's death in uterus, Bart's hemoglobin present, that's in a homozygous state. But if it is heterozygous, it's difficult to detect even in an adult. ये minor की बात कर रहे हैं, heterozygous one. Okay. Now delta thalassemia homozygous का तो नहीं है, लेकिन heterozygous में it is reduced hemoglobin A2 level. Thalassemia like state, the clinical picture of thalassemia, but normal levels of hemoglobin A2 and F. All right. Now, the thing is that thalassemia, this used to be a terrifying disease. There was a time when people were very much scared of thalassemia, और वो जो कहते हैं कि अगर सोसाइटी में किसी को पता चल जाए तो used to be, oh my God, it's got thalassemia. Oh God. No, but now it's a treatable condition. We know it's treatable. Okay, we have seen blood transfusion centers. Okay, so where blood is transfused to such children, and there are many other individual people also helping. Individual societies are formed to help thalassemic patients to lead a normal, healthy life. And these individuals, they go on to lead a happy and healthy lives. Minor के साथ तो ठीक है, but with major blood transfusion is required. It requires combination of blood transfusion, bone marrow transplants too. Therapy में है कि bone marrow transplant भी करते हैं, medications और chelation therapy. As I said, iron overload होगा तो chelation therapy की जरूरत है. What the point? इसमें because of repeated blood transfusion, iron overload होता है and chelation therapy is required. Now, chelation therapy is used after blood transfusion to remove excess of heavy metals like iron. And thank you, and that's the end. I hope all the things are clear to you. Okay. I hope yes. Yes, Anusha. Wait a minute. I'll have to unmute you.
Ma'am, assalamualaikum.
Walaikum salam. Yes. What's your question?
अल्फा थैलेस्मिया वाली स्लाइड थी ना, वो रिपीट कीजिए.
कौन सी वाली स्लाइड बेटा?
अल्फा थैलेस्मिया,
अल्फा
हेमोग्लोबिन वाली.
अल्फा थैलेसीमिया स्लाइड ये वाली
नहीं मैम, हेमोग्लोबिन वाली है, दूसरा आई थी.
ये वाली बेटा अल्फा
Yes,
थैलेसीमिया ये चाहिए. अच्छा देखो, ये फीटल रेड ब्लड सेल्स है, ठीक है. अब अल्फा थैलेसीमिया के जीन्स की डिलीशन का बात कर रहे हैं हम. इन फीटल रेड ब्लड सेल्स, फीटल में हीमोग्लोबिन एफ में कौन सा होता है? 2 अल्फा एंड 2 गामा है ना. 2 अल्फा एंड 2 गामा होते हैं ना. तो इसमें देखो 2 अल्फा नहीं है, 2 गामा है, ठीक है. गामा का तो दोनों है. अच्छा, 2 गामा 2 अल्फा, इसमें भी यही है, लेकिन इसमें देखो दोनों गामा और दोनों अल्फा मौजूद है, ठीक है. अब इसमें क्या है? हीमोग्लोबिन एफ 89% है, एमसीएच थोड़ा सा कम हुआ है, और हीमोग्लोबिन गामा, लेकिन गामा की अगर 4 चेन्स है 2% है और 8%. दिस इज थैलेसीमिया के ट्रेट है इसमें. ओके, बिकॉज इसके दो जीन्स डिलीशन है, 4 नहीं. 2 गामा है और दूसरे जीन्स में जो दूसरे पेरेंट्स से आया है उसमें दोनों गामा और दोनों अल्फा मौजूद है, ठीक है. ये एक पेरेंट से आया है, ये 2 अल्फा माइनस है, ये एक पेरेंट से है और दूसरे पेरेंट से नॉर्मल इनहेरिटेंस हुआ है, तो ये है ट्रेट. ओके, ये है माइनर थैलेसीमिया माइनर. अब ये है थैलेसीमिया मेजर, इसमें ये दोनों पेरेंट्स से लिया है. देखो दोनों पेरेंट्स से आया है, मदर से भी ये नॉर्मल है. देखो मदर एंड फादर का नॉर्मल है, ये मदर एंड एक या माँ है या बाप है उससे डेफिशिएंट है या नहीं, एब्सेंट है. अब इसमें तो दोनों से ही लिया है उसने, दोनों अल्फा मदर से भी है फादर से भी है. तो व्हाट हैपेंस, दिस इज रिड्यूस्ड एंड थैलेसीमिया मेजर अकर्स, और द न्यूबॉर्न चाइल्ड जो पैदा होता है विद हीमोग्लोबिन बार्स और द 4 गामा चेन्स, एंड दिस इज हाई. जी बेटा,
मेरा ये क्वेश्चन था कि नॉर्मल में हेमोग्लोबिन एफ बढ़ा हुआ है, बट हमने ये पढ़ा था थैलेस्मिया हेमोग्लोबिन एफ बढ़ा हुआ आता है.
बेटा एफ तो बढ़ा हुआ आएगा, लेकिन इवन विद दैट उसके साथ उसमें गामा चेंज ज्यादा है ना, ठीक है, तो बढ़ा हुआ आएगा.